Hello, everybody. Good afternoon. Welcome to our weekly reopening virtual press briefing. My name is Lorna Virgili. I'm the Hispanic Public Information Officer for Montgomery County Government, and I will be helping moderating this briefing today. I'd like to welcome our panelists, the County Executive Marc Elrich, our Health Director, Dr. Travis Gales, and our Office of Emergency Management and Homeland Security Director, Dr. Earl Stoddard. Reporters, please remember to type your questions with your organization's name on the chat box and indicate who would you like to post a question to. Also, we will be taking questions from members of the media only today. Thank you, everybody, for joining us. And with that, let's get started. Mr. County Executive for some opening remarks.
Give me one quick second here. Since my computer brilliantly closed the page I wanted to have open. Where are you, page? I hate it when the computer acts on its own. It is irritating. I'll go without it. So this meeting will be pretty brief. We don't have a lot of big announcements this week. I think you all know we're in phase 2 now, and I think we've been doing pretty well. We've got ambassador teams going out to the businesses, making sure everybody's in compliance. We've had very good success with that. We're putting a very light hand on this, just reminding people that these are the things that we need to do. We are continuing with our message, and you're going to see more of it, about the importance of wearing facial coverings and also dealing with maintaining physical distancing. I believe this is going to stay with us for a while. It's not going to go away anytime soon, and we're going to continue to need to maintain the coverings and the physical distancing. We do not want to be I forget how many states we're up to now, is it 25, that are seeing a resurgence in cases. In a lot of places, the relaxation of standards and going too quickly to opening has led people to believe that we're safe enough to open, we're safe enough to go back to the way things were before. And that is not the message that needs to come out. We are opening things in a way that we think can be done safely. We are not reopening things the way they were before. And it's really important that folks who are listening to this and that the message go out to the community that we're opening the way we are and with the restrictions that we have, so that we can be sure that we stay open. So we don't have to issue orders to go back and close things that we had previously opened, or to go through the same situation that these other states are having, where their bed capacities are being stretched beyond their ability to provide beds. We worked hard to keep this thing in control. We worked hard to make this safe enough to get to the point that we can reopen things. We'd like to keep it safe enough so we can get to the point of reopening more things. We have laid out what a phase 3 might look like, but the phase 3 absolutely has no date. I will not give you a date, you know that. It's all going to depend on what happens with our cases. Dr. Gales, I'm sure, is going to talk about our testing and the number of people we've tested. We're continuing to improve that number. We've added another partner to our contact tracing, and that would be Project Hope, and continue to expand our capability, which fortunately is coming at a time where cases are declining. So it should enable us to get to more people faster. And the other side of this is we need to convey to residents that if you're contacted by a contact tracer, please share your contact information. If we're contacting you, we contacted you because you were probably positive. And we want to make sure, at least on the initial one, we want to make sure that if you were positive, you let us know who you may have also been in contact with. That is critically important to us, and we're hoping that people will continue to share that information so we can do the job that we need to do here. I think what else was on my list of things. We're continuing to work with the governor's folks. They are sharing tests with us. We are using largely the contact tracing program that they've set up, so we continue to work in partnership on some of these issues. And I think with that, I'll turn it over to Dr. Gales.
Good afternoon, everyone, and happy Wednesday. To build upon the county executive's remarks, we have seen, again, improvement into our overall numbers as evidenced by our dashboard. Right now, over the last 5 to 6 days, we have seen case counts average in the mid to high 60s, which is a significant improvement from where we were a week and 2 weeks ago when we were averaging in the mid hundreds and at one point even in the 200s. Now, with that said, we have a job to drive that number down even further. We don't want to just hang out and have that become our new normal from here on out. We actually want to see it drop even more. Because again, the key to having that number drop means we are rooting out the impact of the virus in the community and minimizing the burden of the virus and opportunities for it to be transmitted from person to person. So a couple of strategies to achieve that. Again, we continue to build on our testing apparatus to create opportunities for testing throughout the county, particularly in those areas where we're seeing a higher volume of cases. And part of that strategy includes continuing the test sites that we already have stood up, continuing our mobile helpline that's been in place for a few weeks now for individuals who don't have a provider, gaining access to test. We launched, as the county executive mentioned, a mobile test team that we will use to help supplement our different testing modalities in partnership with Project Hope. And the fourth component is, with all of those things in place, we are looking to create opportunities to do pop-up testing in the community that allows for expansive opportunities to get a high number of folks through and tested in a short period of time. And this would leverage our self-collection kits that we've talked about based upon partnering with the local lab Advogenics to be able to support those efforts. Now, the first pop-up site will go live or will have pop-up event will happen tomorrow in Tacoma Park, the Tacoma Park Recreation Center. Our goal is to test over 400 individuals between the hours of 10 and 2. And please visit the City of Tacoma Park's website with more information about that testing opportunity. Additionally, we hope to be able to roll out similar events throughout the county, again, focusing on those top 10 zip codes, but also looking at other spaces in the county where we can create opportunities for testing. We also have had an opportunity to reach out to a number of community agencies and organizations who have expressed interest in terms of hosting testing sites and opportunities, and we continue to work with them, and we'll be announcing those as those logistics are finalized and will be announced to the community. And one thing I want to highlight with testing is we continue to provide the highest number of tests across the state. We have now tested 8% of our population, which is over 84,000 residents. And we have conducted almost 98,000 COVID tests over the last 3 months. Our test positivity, the 7-day average, is 6.8%, which again is a significant improvement from where we were not too long ago. The other thing I want to mention is we talked about R not values. Our R not value ranges continue to be in the 0.5 to 0.7 range, which is below 1. And additionally, the contact tracing component, as the county executive mentioned, we're working with the state to support that effort. And we have begun the process of interviewing other individuals to bring into the county, as well as creating opportunities to partner with organizations within the county to be able to embed contact tracers within their organizations to help support, help recruit and maintain a diverse cadre of contact tracers to support the efforts that we have. One thing I want to mention and highlight is the issue of face coverings. This has come up a number of times. In addition to rolling out phase 2, we put out a health directive to further emphasize where face coverings should be worn. Now, the face covering requirements are in indoor and outdoor spaces where physical distancing is difficult to maintain. And that is included in some of our specific requirements for facilities such as gyms as part of their efforts to reopen, you are required to wear a face covering while you are in the facility and while you're exercising. Additionally, it has come up in terms of folks saying, well, you know, I'm out in the park and I'm walking and I'm away from people, but then I encounter people. The goal is for face coverings are to protect you and protect me in terms of preventing the spread. And so what we're asking people to do is when you are in spaces where you can't maintain a 6 foot distance between you and other people, is to have your face covering available so that you can put it on. Because again, the intention of this is to make sure that we are mitigating transmission from person to person, and face coverings have been found to be effective in doing that. I know this is a long haul, and we're continuing to ask you to do stuff that is not consistent with what our daily lives and normal routines were back in February, but there's a reason behind it. There's science and data behind it, and the things that we're asking you to do are being done to keep you and your family safe, and to keep us from having to, as the county executive mentioned, in a number of other jurisdictions and states across the country, to keep us from having to rescind some of the things that we've allowed to be opened again based upon the data, so that we can continue to move forward. Thank you.
All right, and for members of the media, just a quick reminder, your questions on the chat box so that we can address those after Dr. Stoddard. Dr. Stoddard?
Thank you very much. Good afternoon. A few updates today, and so obviously we are in phase 2, and we continue to receive inquiries on a daily basis about clarifying questions related to phase 2. We've set up a Q&A team, which is a sort of a task force within county government to address questions. We've gotten more than 80 unique questions in terms of things that require us to think through the specific rules and make sure that we provide guidance to those situations. And so we're meeting on a daily basis to hash out, make policy decisions as it relates to nuances of specific businesses or opportunities or mixed opportunities, as it were. In addition, our ambassadors, the county executive has already talked about this relative success. That they want to provide some numbers. So we've visited 1,598 unique businesses at this point and made 431 follow-up visits. So what typically happens is we'll go out, and if we observe a business that may be having some issues, we'll just educate them. We'll never, our ambassadors will never issue a citation, nor will they, specifically shut down a business for how they're operating, unless, for example, we've had a couple businesses who weren't supposed to be operating per the rules, and they'll let them know that they're not included in this phase, or maybe in previous phases they were restaurants that were open for indoor before they were allowed, things like that. But we've not shut down any businesses or cited any businesses through the ambassador program as it relates to their compliance with the public health measures. We provide education, and we'll do a follow-up visit if we see things that we've educated them on, just to make sure that those things are being done. And in all cases that I'm aware of, we've had good compliance, and people have done exactly what we've asked them to do, which is great. Other things, so Food Security Task Force continues its work. We are continuing to see an uptick in social service calls coming into our 301 call center, which is a reflection of what we're seeing in the social service needs in the community. About 15% of our call volume is focused on social service needs through our 301 call center at this point. And some of those calls can be very complex, and we've got a food access call center that we've set up on the back end of 301. So if you call 301 for food needs, you're routed to this call center, and they spend 30 to 45 minutes on the call with each caller to talk through all the options that are available to them for food support and other social service needs, trying to get them a across the board support. So obviously it's very important to us that people continue to receive food. We know the council has provided some additional resources, this week on that. Obviously, we're supportive of increasing, and we know that this is going to be something that's going to require a great deal of attention moving forward. 4th of July is coming up. There will be no public fireworks displays, but we are working on some activities to recognize the holiday. Just a reminder, fireworks are prohibited in Montgomery County, and please do not, we don't want to see injuries at home because people are trying to replicate public fireworks displays in their backyards. This is something that actually across the country has been observed in some places. We do not want to see that happening in Montgomery County. It is absolutely a safety risk. our fire rescue staff have spoken about it, and I just want to reiterate that message. And the last thing I want to clarify is we've gotten a lot of questions on the pools. So, generally speaking, we have permitted pools to open up in the county. They follow guidance that's available on our website, where you divide the square footage of the pool space by 36 to determine how many people are safely in that space. We are still working on training staff and for our county pools. We don't have a date specifically for our county pools yet, but we're working on it. Obviously, we took to heart exactly what we were telling to the public, which is that we did not have a date when we were going to be ready to move to phase 2. And so once we were ready to phase 2, we told our, that it takes us 600 staff to come in and train. And we did not start that until we knew that we could open our pools. And so it's taking a little bit of time to get that done, but we'll be opening up our pools as soon as we're ready. And so, if you're interested in operating a pool, I think we've done you have to get inspected by the county first, as is required in any other year. I think from the most recent report that I've heard, we've done about 60% of the pools that need to be done. And so there's still a fair number of pools that must get their inspections done. They can call 311 to get that inspection done. And that's step one. And there are some basic guidance that's available on the website for operating a pool that speaks to the cleaning requirements and the physical distancing, things like that. And so certainly if you have questions, you can call 311 and we'll be happy to answer them. Thank you. I'll stop there.
Thank you, Dr. Stoddard. For the members of the media, do remember to identify your organization when you put the message on the chat. And we have the first question from Caitlin Peets from the Bethesda Beat. Actually, it's two questions. One about data for the county executive, and the second one for Dr. Gales about nursing homes.
Hi, I will start with the county executive. Good afternoon, Mark. How are you?
That's lovely.
Good. You said very clearly that you won't give a date for the third phase of reopening, and it will depend on the metrics. Is there a timeline for how long you guys want to monitor that data and see improvements? Is it 2 weeks again? Have you decided? What's that look like?
I don't think it's a matter of a timeline to monitor the data. I think it's reaching a point where the data makes us comfortable that we'll reopen. I mean, at the moment I start talking about timelines, then people think I've got a magical timeline and things will snap into place when a certain date arrives. And so we're going to continue to look at it. I know Dr. Gales has said he needs to push these numbers lower. We've got to make sure that, getting to zero is probably not going to be possible, but getting to the lowest number that we think is feasible is what we need to be able to achieve in order to make sure there's not a reservoir of infection in the community that can be spread. There is a point probably where the combination of a very low number of cases in the community, as well as our emphasis on social distancing or physical distancing and wearing face coverings, is going to ensure that we don't spread the infections. But that's our goal. So I continue to be really careful.
Okay. All right. Thank you.
I know I'm frustrating to deal with when you guys want a date, but I can't help it.
No, it's okay. I think that is fine. Moving on, Dr. Gales, kind of an open-ended question for you, but I don't think we've talked about our nursing homes in a while. How are we doing there? Are residents still able to be tested consistently? Are there any problem areas or things the county needs to improve upon to help staff our residents at this time? How are we doing?
Sure, that's an excellent question, Caitlin. And so nursing homes haven't been forgotten. Even if we haven't talked about them, we've continued to work hard to keep the residents of those facilities safe. So as you know, the state did with the National Guard team that had been in place up until the beginning of June, they did a wave of testing of all the different facilities. So as of early June, each facility had a round of universal testing, meaning there had been at least one effort in the facility to test all of the residents as well as the staff. Now, as things move forward, the governor had a press release on Friday talking about, and consistent with the Centers for Medicare and Medicaid Services, laying out criteria for nursing homes to reopen. And so they have to work with the local health department to attest that, one, they don't have any cases. They have had universal testing and have adequate supplies to take care of their residents and restrictions in place for visitors, as well as enough staff to support their efforts ongoing. And so the local health department has continued to support the nursing homes in those efforts to address those areas. Additionally, the state is, for those nursing homes that continue to have cases, the state is providing testing kits to those facilities to do biweekly testing so that they can identify cases as quickly as possible and isolate those. We as a county are fully prepared to be able to support those efforts and provide additional testing as needed to different facilities. We also are looking to be able to provide a similar effort in terms of test supplies to assisted living facilities that were not included in that first wave of universal testing by the State National Guard team and nursing home teams. Our current LNR staff, licensing and regulatory services staff, is going through and conducting inspection control surveys of all the different nursing homes in the county. There are 34, and that process is to be completed by the end of the month. As of earlier this week, we had completed 10 of those, and as part of that process, again, it's going through and reviewing that standard infection control practices are in place, but certainly given that we are in the times of COVID, making sure that they have adequate supply and adequate provisions to minimize the transmission of the virus as much as possible.
Great, thank you.
Thank you. We have a question from Randy Bass with WDBM. Question for Dr. Gales and also a question for the county executive. Randy?
Good afternoon, everyone. Thank you for having me on the call today. A question for both the county executive and Dr. Gales and Dr. Stoddard, if you'd also like to chime in here. We've got the July 4th holiday weekend approaching. Are any of you worried about residents traveling to other jurisdictions or states that might have more lax restrictions than we do? And do you worry about people bringing the virus back here during a time when Montgomery County really seems to be heading in the right direction?
Randy, this is Dr. Gale. So I think you may have been listening into some of our conversations before we went live. So that's an excellent question. And one, it's not only for some of those, but it's in general, any of those jurisdictions in terms of bringing back. We have, because our responsibility is to keep people safe and make sure people are doing the right thing here, and also keeping folks safe as much as possible from bringing anything in. So as you may be aware, the governors of New York, New Jersey, and Connecticut this morning put in directives requiring individuals who have traveled from those high-risk areas, I think there are 10 states that were included in their directive, to quarantine, similar to what states were doing for the New York, New Jersey, and Connecticut area several months ago when they were at their highest peak. We are aware of that. We've had some internal discussions about what that looks like, and we think it's, we will see. All I can say is we're continuing to assess that here in our local jurisdiction, but also are curious to see if there will be any guidance provided at the state level on this issue.
Okay, we have a question from Shanika Grimshaw with WDVM. The county just received 20,000 masks from its sister city in China. Where and how will they be distributed?
I can probably, unless the county executive wants to start off, I can certainly.
No, go ahead.
Okay. So we've got ongoing efforts to distribute personal protective equipment to a number of different places, and these masks will likely just be folded into that process. We certainly appreciate the support. I mean, obviously, we've had to develop a huge distribution network within Montgomery County to get these resources out to those who need them. And to give you some examples of where these masks will likely end up based on what we've been distributing, certainly our nursing homes and long-term care facilities continue to receive support from the county for personal protective equipment. That's an important part of what Dr. Gales alluded to with providing a holistic level of support for them. In addition, private healthcare providers, including dental offices, will also receive a portion of these masks, given that they have to follow strict requirements to be able to operate, and healthcare is an absolutely essential portion. We have been supporting them as well. In addition, as we reconstitute our county offices, we know that there are going to be additional staff, for example, housing inspectors who are going to come back in and will need additional personal protective equipment to be able to conduct the housing inspections, which I know the county executive has spoken very heavily, over the last, year and a half about how much more we need to be doing in this arena to protect our residents from unsafe housing conditions. So getting people back out and being able to do inspections will be an important part of getting things back to not normal per se, but getting things back and operating. And we'll utilize that personal protective equipment that's been donated to help us support those activities, which are also very important. So,
County Executive?
What he said.
We have another question here from Monique Hayes from NBC4. Monique, do you want to go on the air or do you want me to read the question? I was just about to write to you. Okay.
You can read it. You can read it. That's fine.
Okay. Do you have to register for the pop-up clinic being held in Tacoma tomorrow? And how was the public notified about the pop-up clinic?
Sure, I'll take that. So the testing event has been done in partnership with the city of Tacoma and Tacoma Park. And so they have provided, advertising and publicity for the event through paper flyers, as well as, focused on that neighborhood, as well as through their electronic platform and profile. So that is how the publicity strategy has gone, working with them. And yes, so individuals were asked to register within the system. And the reason for registration is that allows, given that it is a new system, allows for residents to register in the system so that their contact information is already uploaded with the lab, so that their information can be input, and it will go seamless and smoothly, hopefully, when they come to the site, get their test, and then also make sure that we have their contact information to make sure that they get the results in a timely manner once it's resulted. The reason for this system is, as you think about it, when you go to your regular physician, if you've got a regular doctor, and you're in a one-on-one situation, that test is ordered. When it gets into the system, all of your stuff from your electronic record, for example, it makes it easier to order and transmit. And when the result comes in, it's sent to the medical provider who's ordered it, and it's shared with you. As you can imagine, when we're doing testing in a setting where we don't have a physician or some type of medical provider doing that in that office setting, we've got to be creative and come up with other strategies. So hence, that is why we've asked folks to register to help with flow and help make sure that the information moves smoothly and folks get the results in a timely manner.
Thank you, Dr. Gales. We don't seem to have any more questions from members of the media. Mr. County Executive, would you like to have some closing remarks?
I just want to thank everybody for coming and asking questions today. We'll be doing, I think we're doing another press event tomorrow. There's a lot going on, but I think, basically the good news is that we've reached a little bit of stability in a better place than we were before. It is good to see the numbers as much below as they are from 2 and 3 weeks ago. And we're hoping that we continue to maintain it. And I think everybody in this county should take credit for being able to get to this point, because if people had not followed the directions that we had put out there, we'd never get here. And by that same token, the only way we're going to get to the next place that I know all of us want to go is by continuing to follow the behaviors that have made it possible for us to achieve as much as we've been able to achieve so far. So if there's any message that I want to get out to the people of the county, is that you're doing a good job of moving us in the direction that we need to go. I know it's hard. I know I'm like the rest of everybody else. I'd like to go be able to do some of the normal things I used to be able to do. We will get there, but we'll get there when we work at this together, and you all are doing a great job doing that.
Thank you, County Executive. Thank you, everyone, for joining us this afternoon. And remember, the weekly reopening virtual press briefings take place every Wednesday. Thank you. Have a great afternoon.
Thank you.